Here we will see other walls. We have seen the important lateral wall and the posterior wall of the middle ear. Now other walls, what are the important structures to see? So see here, already the same picture right here. This is anterior, this is posterior. The two ossicles have been removed, leaving behind the stapes. So this is how the medial wall of the middle ear, the labyrinthine wall of the middle ear will be looking like in the real anatomical picture. So first thing, how this facial nerve is been oriented, how it looks like, how it runs in the medial wall, we have to know that. So the facial nerve, I told you this is the medial wall of the middle ear. In the facial nerve, it has a labyrinthine part like this. It will be running like this, labyrinthine part through the inner ear. And from the inner ear, it takes an acute curve. That is the first genu area. So this is the first genu area, acute curve. It takes a acute curve, and the pinkish line you can clearly see, that is the horizontal part of the facial nerve. So labyrinthine part, the first genu, and the horizontal part. From the horizontal part, it takes second genu, second curvature at the level of pyramidal process. Please remember that is a pyramidal process in the posterior wall. And from that area, it takes a vertical part of the facial nerve. So this is the orientation of the facial nerve. The labyrinthine, first genu, horizontal segment, second genu, and the vertical segment or the mastoid segment. So this is about the facial nerve orientation. And this is how it looks like in the real anatomical picture. Okay. Now, in the medial wall, the major bulky bone, that is the promontory, which is formed by the basal turn of the cochlea. Promontory forms the prominent bony structure in the middle. And in the posterior part of the mesotympanum, middle ear, we have the oval window, which is covered by the stapes, and the round window nick. So this is where the round window will be present deep inside. So that is a round window. So these are all the two structures in the posterior wall. And in the anterosuperiorly, there is a bony structure, a prominent bony structure which is present, that is called processus cochleariformis. That is very, very important structure. The processus cochleariformis is the most prominent structure in the middle ear. Like the most prominent structure in the tympanic membrane is the lateral process of the malleus. Here, the most prominent structure in the middle ear is processus cochleariformis. And this processus cochleariformis forms very importantly, the landmark for the first genu of the facial nerve. This is very, very important structure, processus cochleariformis. So these are all the important things to note in the medial wall of the middle ear. We have seen the posterior wall of the middle ear, where we have this adductus which enters into the antrum, the pyramidal process, and from there the vertical part of the facial nerve will go on, and lateral is the facial recess, and medial is the sinus tympani. Two foci on either side of the vertical part of the facial nerve. This is a posterior wall, just for your refreshing points. And the anterior wall is nothing but a very simply, the bigger opening is the eustachian tube orifice. So eustachian tube connects the anterior wall of the middle ear to the lateral wall of the nasopharynx. Eustachian tube, and above the eustachian tube is the canal for the tensor tympani. So this is the canal for tensor tympani muscle. So the tensor tympani muscle attaches with the process cochleariformis and hooks from there to get attached to the neck of the malleus. Okay, and above which there will be a small canaliculus, that is called canal of Hoogier. This canal of Hoogier, this is the vertical part of the facial nerve from where the chorda tympani arises and goes exit out of the middle ear through this canal of Hoogier. That is the point for canal of Hoogier. So this are the structures in the anterior wall: eustachian tube, canal for tensor tympani, and canal of Hoogier. So these are all the structures, how it looks like in a picture question. Please remember, so that you can have some good orientation if you are getting a picture questions. Okay.